I could not envisage the practice working without a patient participation group.
It's a wonderful experience, it really is.
It does seem that we are quite influential in their decision making.
You can only change things if you were part of it.
They've become the voice of the practice with the patients.
They've been a great help to me personally.
I'm putting something back in and I'm only too pleased to.
We've had some wonderful creative ideas from our patient participation group.
There are now hundreds of patient participation groups, or PPGs, across the country. This video describes the work of 7 such groups, chosen by the National Association for Patient Participation, because they provide contrasting illustrations of patient participation at work. It is aimed principally at key decision makers within primary care, especially GPs. A longer, more detailed version of this video is also available. Testvale Surgery has a sophisticated information resource centre run by the PPG. This makes use of PatientWise, a database with information on over 500 medical complaints, and Traveller, which provides medical advice for travellers and saves a great deal of time for the treatment room. The centre is staffed by volunteers and is open for 23 hours each week. Cookham Medical Centre, PPG, organises annual health promotion events and attendance typically exceeds 100. Topics have included mental health, chair-based exercise, men's health and diabetes. The practice sends letters of invitation to patients with a relevant diagnosis. Other GPs at the practice are equally appreciative of the work of the PPG.
We held an annual education evening for patients, which is always well received, and it allows us to put messages across. So I don't foresee it being a huge amount of investment in time, and I actually think the time investment that is made really pays off, because you're actually really delegating a lot of tasks for communication out to the wider patient group that you would probably spend 3 times the amount of time trying to do yourself.
New Court Surgery serves a semi-rural community. The PPG was asked to set up a transport scheme. Local buses are infrequent, and so this saves taxi fares or considerable inconvenience. It also reduces the need for home visits. 2 coordinators receive a fax from the reception team requesting help. The coordinators match one of the 30 or so volunteer drivers to the patient. They also telephone the patient and tell them who the driver is. But the PPG is about more than just transport. We asked founder chair Dennis Arkenstall what he considered to be the PPG's main achievement.
I think the most important thing is that it's still here. We started, whatever we started is still going. We started the...
12 years on.
12 years on, yes. We started the transport scheme and it's still going.
The PPG at the Doncare practice in Doncaster encouraged the formation of a patient support group.
The more you talk to patients, the more you see that there are gaps in services. And I was aware from the PPG that there was a gap in service in helping people who kept coming back to us all the time, and we weren't really we were putting sticking plasters on the situation.
Volunteers drawn from neighbouring practices offer a listening and advice service.
It was set up as an additional service to the patients at this surgery who were experiencing non-medical problems. If they're depressed, it's usually because of another reason, i.e. financial or bereavement or relationship problems. And this is the sort of information we try to get from them so we can point them in the right direction.
Other PPGs are advising their practices, helping them to work with their communities and supporting them with outside agencies. The Church End Medical Centre in Brent, for example, is helping to rebuild trust within the community.
Yes, this is a vision we have in mind, but before we can get anyone to approach another person in an area like ours, one has to be very cautious. So in fact, when we set up the Patients Participation Group, one of our objectives or our vision is to recreate the community spirits that we have lost over the years in inner city areas like ours.
With links to the local pharmacist, housing association and the expert patient programme, Early indications are that good progress is being made.
I've seen it in the meetings, actually. I was quite surprised, actually. Yeah. And it's quite, I think, I don't know, for the first time, in fact, when we had the meeting last time, the sickle cell one, the patients were very, very appreciative because they said for the first time, they are being made aware to understand about their diseases, you know, because they didn't know anything about certain things. Yes. It's amazing, actually. Even the patients that come to the meetings, they're very, very happy.
In Stockton-on-Tees, the Riverside Medical Practice, PPG, has been an important advocate for the practice.
They've also helped us with fighting the council about the car parking problem outside. And they've also been a great help for us in moving to new premises, which we're hoping to do in September. So they've represented the practice to the PCT board, and they've even attended meetings. They're also been helpful with our staff in helping the patients, educating to reduce their inappropriate out-of-hours calls as well. They've done a campaign putting leaflets and notices up, educating people not to call doctors for minor ailments during out-of-hours.
Final example of patients contributing to the life of their practice comes from the Highcliffe Medical Centre near Bournemouth.
We actually wanted a group of people who, rather like governors in a school, could understand a little bit more about the healthcare system and could give us a strategic input into how we run the practice and how we meet the patient's needs. And that's what we really wanted as their role.
So the PPG can offer a holistic approach to the practice.
The PPG are a good litmus test of how it's going to go down with the local population. And that's terribly important. You know, we don't want to go around upsetting people. We want to actually improve the service and carry the community with us when we're doing things. And this is one way of achieving that.
And would our interviewees recommend PPGs to other practices?
Every practice has got to take its own view, because every practice is different and populations vary enormously. But I think if you really want to be, I think it's a missed opportunity actually if you don't give the patients some room to take a view on the services you're providing and what you're not providing, what you're missing.
And I feel that we have our complaints rate is virtually nil, and I'm sure it's because the patients have actually got a mechanism to comment about our services and before it actually gets to a complaint.
There's a lot to be gained for the GP, for all the GPs, just to have the patients understanding some of the difficulties that they might be working under, just to have those patients able to relay things to other patients. There's a lot of skills and knowledge and so on within the patient group.
Certainly, it's been a great help to me, and we've got very healthy dialogue going back and forth, and people know what's feasible in the health service and the expectations are met. So it's been, I would thoroughly recommend it to all the practices.
A significant effort was required to initiate the groups, but they require relatively little practice input now. The PPGs have not been a vehicle for excessive patient demands, or a soapbox for particularly demanding patients. Quite the reverse, in fact, as PPG members have become more aware of the constraints on practice decision-making. The last word goes to Dr. Bob Gilbertson at Highcliffe Medical Centre.
I think it's been very successful, and I would go so far as to say that if I was starting again, formation of the PPG would be one of the very first things that we did.
If you are interested in further advice and information about patient participation groups, NAP's website address is www.nap.org.uk